Welcome! Today, we are going to talk about the skeletal system. There are 206 bones in an adult skeletal system. The cartilage, joints, and ligaments make up together 20% of the body mass. Now, we will proceed to the Let's get back to our topic. The skeleton divided into two major sections, the axial bones and the appendicular bones. The first major section, axial bones, is found in the head and torso. It consists of skull, vertical column, and thoracic cage. The second major section is the appendicular bones. It is found in the appendages limb and composed of shoulders, arms, legs, and pelvis.
The skull. The skull is made up of cranial bones, bones that surround and protect the brain, and facial bones, bones that form the eye socket, nose, cheeks, jaw, and other parts of the face. An opening at the base of the skull is where the spinal cord connects to the brain, also called cranium. Function. The skull consists of 22 bones in most adult specimens, and these bones come together via cranial sutures. The function of the skull is both structurally supportive and protective. The skull will harden and fuse through development to protect its inner contents, the cerebrum, cerebellum, brainstem, and orbits. The functions of these skulls. In humans, these sensory structures are part of the facial skeleton. Functions of the skull include protection of the brain, which we already all know, fixing the distance between the eye to allow stereoscopic vision, and fixing the position of the ears to enable sound localization of the direction and distance of sound. It is important to note that the skull is a vital bone in the body as it houses the brain, one of the delicate organs in the body. It serves as the protection for the brain and the facial skeleton, which is more delicate as it consists mostly of thin-walled bones.
Thoracic cage. The thoracic cage, also referred to as the rib cage, is an osteocartilaginous structure that surrounds the thorax. It resembles a dome bird cage with horizontal bars made of ribs and costal cartilage. The vertical sternum and the 12 thoracic vertebrae support it posteriorly. The thoracic cage is a rigid upper body structure that protects the vital structure within. Example, heart, lungs, aorta, etc. It supports, stabilizes, and protects the thorax and organs, as well as facilitating breathing and muscle attachment. The cage also resists the negative pressure created by the lungs' elastic recoil. The thoracic cage is made up of 12 pairs of ribs. We also have one sternum thoracic vertebrae. All this part is made up of thoracic cage. There are 7 true ribs and 5 false ribs. The first pair of 7 ribs, starting from superior to inferior, are called true ribs. The reason they are called true ribs because they have so-called costal cartilage that unites with directly to the sternum. The last 5 pairs are called false ribs, and they are called that because their costal cartilage does not unite with the sternum. There is also a 2 ribs that doesn't attach in any costal cartilage or even connect with other ribs. Thus, it can be seen as floating ribs.
Vertebral column, in other words, spinal column, in short, backbone, is a flexible column made of series of bones, which is the vertebrae. The vertebral column is composed of 33 vertebrae, but we'll set that aside first and tackle about the function of the vertebral column. So the function of the vertebral column is it protects the spinal cord, and it also synthesizes stiffering for the body and attachment for the pectoral and pelvic girdles and many muscles. It also transmits body weight in walking and standing. So the significance of the vertebral column is that it protects your spinal cord from getting damaged or getting injured, and it supports the body. The reason why the vertebral column is important for the spinal cord is because without it, the spinal cord will basically damage and be injured, which causes our body to not move, or in short, paralyze. Now we go back to tackle about the 33 vertebrae. Now these 33 vertebrae is divided into 5 groups, and they are cervical, thoracic, lumbar, sacral, and the coccyx, each of which has unique features suited to its functions. There are 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 fused sacral vertebrae, and 5 fused coccyx vertebrae. The upper 24 vertebrae, which is cervical down to lumbar, are separated by intervertebral discs. The sacral and the coccyx are fused. Fused means to join as one, or to blend as one, or combine. So the cervical supports the head, the thoracic holds the rib cage and protects the heart and lungs. The lumbar bears the weight of the upper body and larger to support the stress, especially when you lift something heavy. The sacral connects your spine to your hip bones, and the coccyx provides attachment points for ligaments and muscles of the pelvic floor.
Before we proceed to the appendicular bones, we shall have an intermission number. Let's give an applause to Roxanne.
ビンクスの酒を届けるよ。海風気任せ波に任せ。潮の向こうで夕日も騒ぐ。空に輪をかく鳥の歌。さよなら港、紬の里よ。どんと一丁歌を船出の歌。キンパ銀パもしぶきに変えて。俺たちは行くぞ海の限り。ビンクスの酒を届けに行くよ。我ら海賊海割ってく。何を枕にねぐらは船よ。鬼旗にけたってはどっくろ。
Pectoral girdle. This is compromised with clavicle, are also known as collarbone, and scapula, the shoulder blade. They attach the upper limbs to the axial skeleton. The clavicle has sternal end when detached to the manubrium, and acromedial, and which join the scapula. The scapula is a thin flat bone roughly rectangular. There are three borders: the superior, medial, and lateral. The upper limb in the arm found the humerus, a typical long bone, a greater tubercle, radial groove, medial epicondyle, lateral epicondyle, radial fossa, canoid radial fossa, trachea, and capitulum. Moving on the forearm, we now see the two bones, the radius and ulna. These are connected all the way down to the inner osseous membrane, a flexible digitimate. The ulna is slightly longer with its olecranon and caronoid process. The radius goes from wide to thin the other way with the two heads, the radical tuberosity and radical styloid process. From there, we see the hand, which has many separated bones. The carpus or wrist is made of 8 short bones called carbones. These are the scapoid, lunate, triquetrum, pisiform, and the trapezoid, capitate, and hemate. Next, we see the 5 metacarpals, which make up the palm of the hand, and their simplified name 1 to 5 form from thumb to pinky. These are the distal phalanges, middle phalanges, proximal phalanges. These connect to phalanges, which are the bone make up your fingers. There are 14 bones per hand, 3 forefingers, which are the distal, middle, and proximal phalanges, except for the thumb, which only has 2 and no more middle phalanx.
The pelvic girdle or hip girdle is formed by a single bone, the hip bone or the dorsal bone, which serve as an attachment point for each lower limb. The pelvic girdle is the structure to where the leg bones are attached. The pelvic girdle is made up of 2 oxcapsi or hip bones. Each hip bone is divided into 3 sections: the ilium, the ischium, and the symphysis or pubis. Its primary role is to support the weight of the upper body when sitting, and to transfer this weight to the lower limb when standing. It serves as an attachment point for trunk and lower limb muscles, and also protects the internal pelvic organs. When standing in the anatomical position, the pelvis is tilted anteriorly in this position. The anterior, superior iliac spines and the pubic tubercles lie in the same vertical plane, and the anterior or internal surface of the sacrum faces forward and downward.
Lower limb forum. The lower extremity of the room or extremity is the lower end of the room. Tight bone in human and other animals closer to the knee. The robust bone of the lower limb support the weight of the upper body, facilitate locomotion, and contain strong, stable joints. Tibia from knee join the distal end of the tibia and fibula from part of the ankle joint. Articular cartilage, also called hyaline cartilage, covers the joint surface where the the ferrum, tibia, and patella articulate with each other. The capsular ligaments include the iliophomeral ligament of Bigelow, and the fovofemoral and the ischiofemoral ligaments.